das verwechselt.
There must be a mistake. It can't be true. I just can't be me.
Jetzt bist du doch total rausgefallen aus dieser ganzen Sache.
Now you have completely dropped out. From the university and everything. You're somehow on another planet.
Sie gehen zu einer Besprechung oder zu einer Untersuchung.
You meet with a doctor or have an exam, you get the result, and that evening simply aren't the same person anymore. For many people, when you're diagnosed with cancer, it's as if half of you has been erased. Subconsciously, they already assume that cancer can't be healed.
Ich selber konnte ja auch nichts dazu tun. Ja.
I couldn't do anything about it myself. I was just the passive patient. But still, no one wanted to make a prognosis about how long it would last or if something might help.
Als medizinische Laie steht man dann da.
As a layperson, eventually you have to decide yourself. You get many opinions from people who are all health professionals. From these, you have to make up your own mind. What should I do now?
Ich persönlich frage sehr
Personally, I always ask very specific questions. What do you want? What do you want? Not me, I'm not in the situation. You're in the situation. You're allowed to and should decide what you want. Of course, based on my explanation of the options that are available, of the consequences and possibilities that there are.
Ich habe gefunden, ich möchte mal abchecken, was.
I wanted to find out what the Lukasklinik had to offer. They also highly recommended undergoing chemo and then coming to them afterwards for recovery using Iscador injections.
Ich hatte ein gutes Gefühl, als ich dort rausgegangen bin.
As I left the clinic, I had a good feeling. Among other things, I thought it was great that they had also recommended traditional treatment. They were very open, and that really impressed me.
Ich habe gewusst, das ist eine Klinik der Anthroposophen und dass die
I already knew it is an anthroposophical clinic and that they offer a cancer therapy using mistletoe. But what I didn't know was that it is actually a hospital. I thought it was something like a rehab clinic. But then once I was there, I immediately realized I was actually in a hospital.
Alle Ärzte, die hier in der Klinik arbeiten, haben selbstverständlich die normale universitäre Ausbildung.
Of course, all the doctors who work here at the clinic have a traditional university education, which is the most basic requirement for treating patients. Doctors who practice anthroposophical oncology in the Lukasklinik receive their qualification for anthroposophical medicine through special seminars.
Der integrative Therapieansatz beinhaltet
Along with medication, naturally the integrative approach to therapy also includes the same medical diagnostics that are applied in conventional medicine, for which we are excellently equipped.
Mein Arzt war auch sehr ehrlich mit mir, also wo wir dann einfach über das Ganze geredet haben.
My doctor was also very honest with me. When we discussed the whole situation, he told me that I had such an aggressive cancer that it would definitely be necessary to undergo chemo and radiation. Mistletoe alone would never be sufficient, but he advised using it as a supplement to the conventional treatment.
In der Onkologie ist es ja so, dass man eigentlich sich ganz konzentriert darauf.
In oncology, the main focus is to get rid of the tumor or metastases if possible. In complementary medicine, and especially in anthroposophical medicine, we try to fortify patients so that they will get over the illness themselves. This is a completely different approach to therapy. The aim is to strengthen the healing potential of patients.
Das erste Mal Eurythmie.
My first eurythmy session was really strange for me, completely wacky. I thought to myself, what are they doing?
Ich hatte sehr Vorurteile, weil ich
I had major preconceptions, and also, suddenly I just didn't feel like it anymore. I had finished chemo and thought, isn't that enough? But then I somehow sensed that it did me good. And after 3 sessions, I thought it was great.
Nach 3 Sitzungen habe ich es super gefunden.
Jetzt kann die Welle umschwenken auf den Rücken. Und da, jetzt braucht es Vertrauen. Lassen wir los. Fangen es wieder. Gut. Noch einmal.
Natürlich waren da auch viele Sachen, die für mich völlig neu waren. Also das ist sowas wie künstlerische Therapie.
Naturally, there were also a lot of things that were completely new to me. I didn't know that there was such a thing as art therapy, or that you would get a plan with things on it like eurythmic or painting therapy. This was completely new to me, but I thought, okay, this is part of the therapy here.
We're not going to create an artwork now. It's about the process and not about the result. The initial priority is that we are able, first of all, to relax, to let go, so that you can sleep better, for example.
Loslassen können, dass sie zum Beispiel besser schlafen können.
Es war einfach, wurde wahnsinnig gut gepflegt.
It was just, you were taken care of incredibly well. People talked to you, and not just for a couple of sentences.
Das Erlebnis, da Leute mich zu haben, die da...
The experience of having people around me who completely believed in what they were doing, who weren't cynical about it, who were, I think you can also really use the word loving. And just this kind of support, the care, already created trust.
Der Versorgung, das hat schon wirklich irgendwie Vertrauen geschaffen. Ne?
Ich war auch in der Kunsttherapie und habe
Sometimes I went to art therapy and I made this ball, and then tears started to flow because I was afraid and didn't know what was going to happen. But as time passed, I became calm, simply through the movement.
Das war das erste Mal, dass ich auch dann selber irgendwie eine Initiative ergreife.
That was the first time I myself could take an initiative. Not only just, please treat me, but rather it was also about my own personal initiatives. And somehow this was what I had been waiting for, to do something myself about what was happening.
Einfach weiter.
Die Möglichkeit, sich dort zu erleben, wo man gesund ist.
What these therapies are actually about is the possibility to experience where one is healthy. I can do something that's creative and afterwards is in tune with me.
Das zu spüren, das hat auf die Patienten einen...
Sensing this has an unbelievably stimulating, beneficial, and healing effect on patients.
Weil es ist genug nass. Und jetzt von unten nach oben.
Neben den künstlerischen Therapien haben wir natürlich die Iskador-Therapie.
Along with art therapies, we naturally have Iskador therapy. Iskador preparation is made from mistletoe. Its different substances have a stimulating effect on the immune system, and they also directly destroy tumor cells.
Die Pflegetherapie, von der wir heute sprechen, ist eine andere Anwendungsmöglichkeit.
We also perform other kinds of therapeutic care. Compresses and ointments are used for relaxation, relieving pain, and also improving the functioning of organ systems. Physiotherapy is also used to support the healing process in these same ways.
Im Sinne der Schmerzlösung oder Organfunktionsverbesserung.
Naturally, you also meet people who are having a relapse again, and of course, this makes you afraid. Or there are people who aren't there anymore. Of course, I always said, no, 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 I will get well again. I will get well again. But in the back of my mind, there was still something tormenting me and reminding me over and over again, you have got cancer. You have got cancer. Fear is a completely weird feeling. When you are sad, you can somehow be comforted. But fear is something that just comes over you. I knew that such a feeling existed, but one day it just overcame me. I was really bad off because I didn't know how long the fear would last. Is the tumor gone now? Is it cured? Did the therapy work? Is there something in your life that you connect with your tumor? Does it have a name, or do you have a feeling about it or thoughts about it? Why is it happening to me? Perhaps one can work out an answer. Why has it happened to me? But maybe there is no answer to this question. I don't know. When I search for the why, it is very difficult because then I'm always just looking to the past, which I can no longer change. But if I rather ask, to what end, for what purpose, or what about now, then I can go forward.
Für mich war ein Schlüsselerlebnis diese
The
Biografiearbeit.
biography work was a key experience for me. I believe coming to terms with your own biography is something fundamental in the process.
Voices, moods, mood swings, being out of tune organically. Speech therapy would like to retune.
Sie hat mir gesagt, stellen Sie sich einmal vor.
One time she told me to imagine there was a tiger in my chest. What would it do? And I said, grrr. And she said, it could never get out like that. I assert myself.
Karrik, karrak, karrok. Karrik, karrak, karrok.
The R could be given a little more space.
Das ist auch, glaube ich, der erste starke Moment in der Lukasklinik.
That was also the first powerful moment I had at the Lukasklinik, when I realized I had to somehow change. It also did so much good knowing that everyone in the clinic was also somehow affected by this illness. I didn't feel so alone anymore. At the beginning, I felt very alone with it.
Am Anfang habe ich mich sehr allein gefühlt mit dem.
Das Morgen in meinem Zimmer und das Mittag und das Nacht.
Breakfast is eaten in your own room and lunch and dinner in the dining hall. Each table sits 6 persons. One person always is the head of the table and serves the soup and main course.
Es hat einfach gut getan.
It simply did me good deep inside. I also regained trust in myself again, trust in my own body.
Es ist keine Kraft.
It isn't a matter of force, but simply endurance. Not to give up until we get to the end, to the edge. Just have trust. It'll happen.
Es kommt schon. So. Stückchen für Stückchen.
Just bit by bit.
Plötzlich entsteht das.
Suddenly something comes into being, and we realize something new has been created.
Und jetzt versuchen wir
And now slowly we try to release this something new from what was,
lösen von dieser
so that at the end maybe we can take it
sodass
in
wir
our
am
own
Schluss
hands.
vielleicht das in der Hand nehmen können. Sehr schön.
Something beautiful has come into existence. Something has been developed through color or sculpture. Afterwards, you also feel like you have made something positive.
Hast du da jetzt irgendwas Positives aufgebaut?
Dieser Wunsch, dass
The underlying wish that the tumor will disappear is very powerful. But often it's not possible, not even with surgery and medication. However, it is possible for me to learn to live with the tumor so that I can say, yes, my life is still worth living. My life is good.
Ich fühle mich gut.
I feel good. Since this summer, I also feel like myself again. I have a sense of humor again. I can work, but I no longer have endless energy.
Ich lebe mit einer Krankheit, aber
I live with a disease, but I live well with the disease. And when I am able to live like this, actually a person can't ask for anything more.
What I became very aware of during this illness is that one should live in the moment and not always think, when I'm retired, I'll do that and that and that. If I'll actually ever be retired or not is something I don't know.